guest is Dr. Josh Fernandez. He is an ophthalmologist at the Eye Clinic of Monroe and on staff at PNS Surgical Center. Thank you so much, Dr. Fernandez.
Thank you for having me
today. We're going to talk about low vision and age-related macular degeneration, but first, I think this is an interesting point. You have a passion for eye health, and it's because of your personal experience. Can you tell me about that?
Yeah, so the quick story on that is that I actually grew up with a mother that was blind due to a retinal disease herself. It's actually one of the diseases I specialize in called retinitis pigmentosa. And she was actually the founder of the Louisiana Center for the Blind, which is over in Ruston, which is a world-renowned training center for the blind. So growing up with a blind mother was certainly an inspiration for what I do today.
Oh, that's a wonderful story. I see that center a lot.
Yeah.
Can you tell me why February is named Low Vision Month and Age-Related Macular Degeneration Month?
Right. Well, that's just a month they chose for it, but certainly this is a condition and an issue that we should all be aware of. Macular degeneration, and this is what we're talking about here, is the age-related type macular degeneration, is one of the leading causes of vision loss for those over the age of 50. And there's a lot of things that we can do to prevent it and treat it nowadays, and so we're just trying to call attention to this issue so that people can be aware of it and to get in for their eye exams.
Who is at risk for macular degeneration, age-related macular degeneration?
Right, so as the name says, it's age-related. So people over the age of 50, the highest proportion of people are as you get older, so about 6 to 7% of the population over the age of 65 actually has signs of age-related macular degeneration. Also, those that are at risk for are those who smoke and those who have high blood pressure and high cholesterol. So those are kind of some of the measures that we actually talk to people about is stop smoking, eat a diet healthy and rich green leafy vegetables, and just live a normal, healthy lifestyle.
What are the symptoms?
So that's a tricky part. So early in macular degeneration, it's very hard to actually see any definitive symptoms that you would actually notice. So something can be as subtle as a small distortion in your vision or a black spot near the center of your vision. But that usually doesn't occur until the mid to late stages of the macular degeneration. So knowing if you have it or not would be something that we would just detect on a routine eye exam. And so that's why the recommendation from the American Academy of Ophthalmology is that everybody gets a routine eye exam at least on a yearly basis.
And what other eye diseases are you focusing on during Low Vision Month?
So Low Vision Month is unique in that when we say someone has low vision, we're talking about any individual that has a particular eye disease with which they cannot receive any additional treatment or surgery that may correct their vision. So these are anybody that has vision that just is where they're not functioning properly. And so that's where we group everybody into. And once you reach that stage where us as ophthalmologists cannot do anything more for you, we will often make a referral to what's called a low vision specialist. And these are people who will sit down with these individuals and work with them to find ways to maximize the use of the vision that they have left. So anything as little as using a handheld magnifier or using TVs that magnify things for you, or getting them linked with the appropriate resources such as the Louisiana Center for the Blind in Ruston or services that are available nationwide for these individuals to be able to function properly in their lifestyles and doing the things that they want to do.
And when should someone go see an ophthalmologist? What are some of the symptoms besides the ones that we just discussed that someone is a sign of maybe something more serious?
Right, so there's a whole host of things that people tell me all kinds of funny stuff that they experience, and really it comes down to a hunch if you feel like something is not right in your vision. So you're noticing a spot in your vision or flashes or floaters in your vision, or the vision suddenly drops and it doesn't come back right away. But really, you wouldn't really know if you have anything serious that's brewing that you don't know about unless you just go in and get a routine eye exam. So I say go in and at least get one routine eye exam done, and then from there we can kind of guide you on how frequently you need to come back and see us.
Okay, thank you, Dr. Fernandez, so much for joining us today and telling about this important information for low vision.
Very good.
And if you'd like to schedule an appointment with Dr. Fernandez, or if you have any questions, you can contact him at the Eye Clinic in Monroe at 325-2020. And up next, we'll have details on the National Wild Turkey Federation Hunting Heritage Banquet. That's after the break.